As a first responder, it is critical to provide medical care to patients with respect for their safety, dignity, and rights. This not only promotes a positive and caring environment, but also facilitates better communication and treatment outcomes. This video will discuss how first responders can show respect for patients' safety, dignity, and rights, along with examples of each. First, respect for patients' safety requires a commitment to minimizing the risk of harm. This can include identifying and removing any potential hazards in the immediate environment, such as sharp objects or slippery surfaces. It may also involve taking steps to prevent further injury or harm to the patient, such as immobilizing a broken limb or controlling bleeding. For example, if a patient has fallen and is bleeding, the first responder can ensure her safety by removing any obstacles, using gloves, and applying pressure to the wound. Second, showing respect for patients' dignity involves treating patients with compassion, empathy, and consideration for their privacy. This can include communicating in a respectful and caring manner, giving patients appropriate time to ask questions and express concerns, and ensuring their comfort throughout the medical intervention. For instance, if a first responder is assisting a patient who has experienced a seizure, they can maintain the patient's dignity by speaking calmly and reassuringly, covering them with a blanket, and providing privacy by shielding them from onlookers. Third, respecting patients' rights involves acknowledging and upholding their legal and ethical entitlements, including their right to make decisions about their care and have their wishes respected. This may include obtaining informed consent before administering treatment, respecting patient autonomy, and advocating for their best interests. For example, if a responder is called to assist a patient who has expressed a preference for a certain hospital or medical provider, they can respect the patient's rights by facilitating this preference if it is safe and feasible to do so. In conclusion, as a first responder, it is important to provide medical care with respect for patients' safety, dignity, and rights. This involves creating a safe environment, showing empathy and consideration for patients' emotional well-being, and upholding their legal and ethical entitlements. By prioritizing these principles, first responders can help and promote a positive and caring environment that facilitates better communication and treatment outcomes for patients. This is Dr. Mella, and this is vlog number 62 entitled Respecting Safety, Dignity, and Rights as a First Responder. Thank you very much for watching. If you like this video, click the thumbs up button, share on your social media feeds, and subscribe to my channel. Hope to see you on the next vlog.